malignancies using synthetic minority oversampling technique. The utility of BS monitoring in anesthesia for elderly patients. The utility of BS monitoring in anesthesia for elderly patients. Association between postoperative hyperactive delirium and major complications in elderly patients undergoing emergency hip fracture surgery, a large-scale cohort study. Early incident and subsyndromal delirium in older patients undergoing elective surgical procedures, a randomized clinical trial of an avoid delirium protocol. The impact of postoperative agitated delirium on dementia in surgical patients. Effects of general and spinal anesthesia on postoperative rehabilitation in older adults after lower limb surgery, a retrospective cohort study. Effects of general and spinal anesthesia on postoperative rehabilitation in older adults after lower limb surgery, a retrospective cohort study. Intravenous infusion of dexmedetomidine during the surgery to prevent postoperative delirium and postoperative cognitive dysfunction undergoing non-cardiac surgery, a meta-analysis of randomized controlled trials. A comparison of efficacy between low-dose dexmedetomidine and propofol for prophylaxis of postoperative delirium in elderly patients undergoing hip fracture surgery, a randomized controlled trial. Postoperative cognitive dysfunction, review of pathophysiology, diagnostics, and preventive strategies. Impact of intraoperative dexmedetomidine on postoperative delirium and pro-inflammatory cytokine levels in elderly patients undergoing thoracolumbar compression fracture surgery, a prospective, randomized, placebo-controlled clinical trial. Preoperative ketamine administration for prevention of postoperative neurocognitive disorders after major orthopedic surgery in elderly patients, a multi-center randomized blinded placebo-controlled trial. The effect on perioperative anxiety and emergence delirium of the child or parent's preference for parental accompaniment during anesthesia induction in children undergoing adenotonsillectomy surgery. COVID-19 vaccination may prevent postoperative delirium in elderly patients undergoing elective non-cardiac surgery, the PINDRFAP and PINDABLE studies. Postoperative delirium and the older adult, untangling the confusion. Effects of Chinese traditional 5-element music intervention on postoperative delirium and sleep quality in elderly patients after non-cardiac surgery, a randomized controlled trial. The effect of dexmedetomidine on the postoperative recovery of patients with severe traumatic brain injury undergoing craniotomy treatment, a retrospective study. Influencing factors of delirium during recovery in urological postoperative patients undergoing sevoflurane anesthesia. Cognitive training for reduction of delirium in patients undergoing cardiac surgery, a randomized clinical trial. Association between preoperative sleep disturbance and postoperative delirium in elderly, a retrospective cohort study. A novel preoperative electroencephalogram-derived index to predict early postoperative delirium in elderly patients after hip fracture surgeries, development of a prediction model. The role of delirium on short and long-term postoperative outcomes following major gastrointestinal surgery for cancer. Related factors of delirium after transsphenoidal endoscopic pituitary adenoma resection, a matched retrospective cohort study. Incidence of confusional syndrome, delirium, in a Latin American university hospital. Incidence of confusional syndrome, front cell infect microbial. 2024 May 21. 14:1380312. DOI 10.3389/sim.2024.1380312. eCollection 2024. Abstract. Legionella, one of the main pathogens that causes community-acquired pneumonia, can lead to Legionella pneumonia, a condition characterized predominantly by severe pneumonia. This disease, caused by the bacterium Legionella pneumophila, can quickly progress to critical pneumonia and is often associated with damage to multiple organs. As a result, it requires close attention in terms of clinical diagnosis and treatment. Omadacycline, a new type of tetracycline derivative belonging to the aminomethylcycline class of antibiotics, is a semisynthetic compound derived from minocycline. Its key structural feature, the aminomethyl modification, allows omadacycline to overcome bacterial resistance and broadens its range of effectiveness against bacteria. Clinical studies have demonstrated that omadacycline is not metabolized in the body, and patients with hepatic and renal dysfunction do not need to adjust their dosage. This paper reports a case of successful treatment of Legionella pneumonia with omadacycline in a patient who initially did not respond to empirical treatment with moxifloxacin. The patient also experienced electrolyte disturbance, as well as dysfunction in the liver and kidneys, delirium, and other related psychiatric symptoms. PMID 3883605 PMC PMC 1114827 DOI 10.3389/sim.2024.1380312. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Efficacy of omadacycline in the treatment of Legionella pneumonia, a case report. Title: VR-related evidence matrix. Antipsychotic nature of antibiotics, vancomycin and omadacycline combination ameliorating stress in a zebrafish model. Relationship between nutrition indicators and pneumonia risk among stable schizophrenia patients, a retrospective study. Prolonged exposure to lung-derived cytokines is associated with activation of microglia in patients with COVID-19. Successful recovery of a catatonic patient with severe pneumonia and respiratory failure, modified electroconvulsive therapy following tracheotomy. A case of surgical treatment for bronchial foreign bodies with obstructive pneumonia. Assessment of sarcopenic obesity as a predictor of pneumonia in patients with stable schizophrenia, a prospective study. COVID-19 hierarchical classification using a deep learning multimodal. Learning to learn by yourself, unsupervised meta-learning with self-knowledge distillation for COVID-19 diagnosis from pneumonia cases. Pneumocystis pneumonia in a patient with alcoholic hepatitis. High-flow nasal oxygen in infants and children for early respiratory Front Med, Lausanne. 2024 May 21, 11:13790019. DOI 10.3389/med.2024.1379019. eCollection 2024. Abstract. Background. This study aims to systematically assess the risk factors, the overall strength of association, and evidence quality related to sepsis-associated encephalopathy. Methods: a systematic search was conducted in the Cochrane Library, PubMed, Web of Science, and Embase for cohort or case control studies published up to August 2023 on risk factors associated with sepsis-related encephalopathy. The selected studies were screened, data were extracted, and the quality was evaluated using the Newcastle-Ottawa scale. Meta-analysis was performed using RevMan 5.3 software. The certainty of the evidence was assessed using the grade criteria. Results: a total of 13 studies involving 1,906 participants were included in the analysis. Among these studies, 12 were of high quality and 1 was of moderate quality. Our meta-analysis identified 6 risk factors significantly associated with serious adverse events, SAE. These included Apache-2, SOFA, age, tau protein, and IL-6, which were found to be risk factors with significant effects, standard mean difference SMD, 1.24 to 2.30, and albumin, which was a risk factor with moderate effects, SMD, minus 0.55. However, the certainty of evidence for the risk factors identified in this meta-analysis ranged from low to medium. Conclusion: this systematic review and meta-analysis identified several risk factors with moderate to significant effects. Apache-2, SOFA, age, tau protein, IL-6, and albumin were associated with sepsis-related encephalopathy and were supported by medium to high-quality evidence. These findings provide healthcare professionals with an evidence-based foundation for managing and treating hospitalized adult patients with sepsis-related encephalopathy. PMID 3883579-4 PMC, PMC 111482460I, 10.3389/FMED.2024.137919. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Factors contributing to sepsis-associated encephalopathy, a comprehensive systematic review and meta-analysis. Title: VR-related evidence matrix. Prevalence and risk of non-alcoholic fatty liver disease among adult psoriatic patients, a systematic review, meta-analysis, and trial sequential analysis. Causal associations between severe mental illness and sepsis, a Mendelian randomization study. Association of screen-based activities and risk of self-harm and suicidal behaviors among young people, a systematic review. A novel preoperative electroencephalogram-derived index to predict early postoperative delirium in elderly patients after hip fracture surgeries, development of a prediction model. June 5, 2024. Evidence. Geriater Ort Hop SURG Rehabil. 2024 June 3. 15:21514593241258654. Joy 10.1177/21514593241258654. eCollection 2024. Abstract. Introduction. It is appealing to accurately predict postoperative delirium, POD, before surgeries. In this study, it was hypothesized that a novel electroencephalogram-derived index, the delirium index, DELI, could extract latent information regarding the predisposing factors of POD preoperatively. This study was aimed at developing a concise model that incorporated this DELI score to predict the early POD of elderly patients after hip surgeries. Materials and methods. Elderly patients scheduled for elective hip fracture surgeries were prospectively enrolled in a tertiary care hospital from November 2020 to June 2022. DELI scores and patient characteristics, age, sex, types of fracture and surgery, the time interval between fracture and surgery, cognitive function assessed using the Montreal Cognitive Assessment, MoCA, and frailty status assessed using the Frail Scale, were collected preoperatively as candidate predictors. POD diagnosed using the Confusion Assessment Method, CM, was the outcome. Least absolute shrinkage and selection operator, LASSO, regression analysis was used to select predictors. Then, these predictors were entered into a backward logistical regression analysis to develop a prediction model. Discrimination, calibration, and clinical utility were validated using the bootstrapping method. Results. All data, 144 qualified patients of 170, were used for development. POD was observed in 71 patients, 49.3%. Preoperative DELI scores predicted early POD, the area under the curve, AUC, equals 0.786, 95% confidence interval, CI 0.712, 0.860, in internal validation. A nomogram with MoCA, Frail Scale, and DELI score was constructed with excellent discrimination, AUC equals 0.920, 95% CI, 0.876, 0.963, in internal validation. Accredited calibration, P equals 0.733, Hosmer-Lemeshow test, and a wide range of threshold probabilities, 5% to 95%. Conclusions. Preoperative DELI scores predicted the early POD of elderly patients after hip surgeries. A concise prediction model was developed and demonstrated excellent discrimination. PMID 388354110 PMC, PMC 111494441 DOI, 10.1177/21514593241258654. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world J. Neuroscience. 2024 June 3rd. DOI 10.1097/JNN.000000000000000000763. Online ahead of print. Abstract. Background. Delirium is a common neurological complication in patients admitted to the intensive care unit, ICU, after moderate to severe traumatic brain injury, TBI. Although current clinical guidelines prioritize delirium prevention, no specific tool is tailored to detect early signs of delirium in TBI patients. This preliminary two-phase observational study investigated the correlation between the pupillary light reflex, PLR, measured with a pupillometer during mechanical ventilation, and the development of post-extubation delirium in TBI patients. Methods: a convenient sample of 26 adults with moderate to severe TBI under mechanical ventilation was recruited during their ICU stay. In Phase I, PLR measurements were performed in the first 3 days of ICU admission using automated infrared pupillometry. In Phase II, 2 raters independently extracted delirium data in the 72 hours post-extubation period from medical records. Delirium was confirmed with a documented medical diagnosis. Point-by-serial correlations, RPB, were used to examine the association between PLR scores and the presence of post-extubation delirium. Student t-tests were also performed to compare mean PLR scores between patients with and without delirium. Results: 10 TBI patients, 38%, were diagnosed with post-extubation delirium, whereas 16, 62%, were not. Significant correlations between delirium and two PLR variables were found. Pupil constriction percentage, RPB 24, equals minus 0.526, P equals 0.006, and constriction velocity, RPB 24, equals minus 0.485, P equals 0.012. The t-test also revealed a significant difference in constriction percentage and velocity scores between TBI patients with and without delirium, P less than or equal to 0.01. Conclusion: our findings suggest that the use of pupillometry in the first 3 days of mechanical ventilation during an ICU stay may help identify TBI patients at risk for delirium after extubation. Although further research is necessary to support its validity, this technological tool may enable ICU nurses to better screen TBI patients for delirium and prevent its development. PMID 388333515 doi 10.1097/jnen.0000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000 Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Association between pupil light reflex and delirium in adults with traumatic brain injury, preliminary findings. Title: VR-related evidence matrix. Prolonged hourly neurologic examinations are associated with increased delirium and no discernible benefit in mild/moderate geriatric traumatic brain injury. Pediatric Crit Care Med, 2024 June 4th. doi 10.1097/PCC.0000000000000000000003555. Online ahead of print. Abstract. Objectives: to determine the patient-level factors associated with performing daily delirium screening in PICUs with established delirium screening practices. Design: a secondary analysis of 2019 to 2020 prospective data from the baseline phase of the PICU-UP Pilot Stepped Wedge Multicenter Trial, NCT 03860168. Setting: 6 PICUs in the United States. Patients: 1,064 patients who were admitted to a PICU for 3 or more days. Interventions: none. Measurements and main results: of 1,064 patients, 74%, 95% CI, 71 to 76% underwent delirium screening at least once during their PICU stay. On 57% of the 8,965 eligible patient days, screening was conducted. The overall prevalence of delirium was 46% across all screen days, and 64% of screened patients experienced delirium at some point during their PICU stay. Factors associated with greater adjusted odds ratio, hour, of increased daily delirium screening included PICU stay longer than 15 days compared with 1 to 3 days, hour 3.36, 95% CI, 2.62 to 4.30, invasive mechanical ventilation as opposed to room air, hour 1.67, 95% CI, 1.32 to 2.12, dexmedetomidine infusions, hour 1.23, 95% CI, 1.04 to 1.44, and propofol infusions, hour 1.55, 95% CI, 1.08 to 2.23. Conversely, decreased hour of daily delirium screening was associated with female gender, hour 0.78, 95% CI, 0.63 to 0.96, and the administration of continuous infusions of opioids, hour 0.75, 95% CI, 0.63 to 0.90, or ketamine, hour 0.48, 95% CI, 0.29 to 0.79. Neither patient age, the presence of family or physical restraints, or benzodiazepine infusions were associated with daily delirium screening rates. Conclusions in the 2019 to 2020 PICU-UP cohort across 6 PICUs, delirium screening occurred on only 57% of days, despite the presence of established practices. Female gender, patients in the early stages of their PICU stay, and patients not receiving mechanical ventilation were associated with lower odds of daily delirium screening. Our results highlight the need for structured quality improvement processes to both standardize and increase the frequency of delirium screening. PMID 3883287 DOI 10.1097/PCC.0000000000000003555. Document the CPD share evidence. Estimated reading time, 5 minutes. Arch or HUP Trauma SURG, 2024 June 4th. DOI 10.1007/S00402-024-05382-7. Online ahead of print. Abstract. Introduction. Cemented hip hemiarthroplasty is a routine surgical option for elderly neck of femur, NF, fractures. It is uncertain if quality of cementing has any effect on functional outcomes. The aim of this study was to determine if the quality of cementing would affect short-term functional outcomes in elderly neck of femur fractures. Biomarkers and psychiatry. Bipolar affective disorder. Borderline personality disorder. Brain MRI, McGill University. Bulimia nervosa. Bullying. Burnout. Cambridge Psychiatry. Cancer and psychiatry. Case control studies in psychiatry. Child and teen BMI calculator. Child mental health. Child psychiatry. Climate and psychiatry. Clinical trials and psychiatry. Clinical trials psychiatry. CME/CPD certificate. CME radio 24/7 from ReachMD. CNS, non-tumor. CNS tumors. Cognitive analytic therapy, CAT. Cognitive behavioral therapy, CBT. Cognitive disorders. Cognitive science. Cohort studies in psychiatry. Community psychiatry. Clinical characteristics of delirium in older patients with first-ever acute myocardial infarction who underwent percutaneous coronary intervention, a retrospective study. June 3, 2024. Evidence. HERS, 2024 June 3. DOI 10.1077/S00059-024-05250-5. Online ahead of print. Abstract. Objectives: delirium is a serious complication of cardiac surgery and a common clinical problem. The study aimed to identify the incidence, risk factors, and outcomes of delirium in older patients, greater than or equal to 65 years, with first-ever acute myocardial infarction, AMI, who underwent percutaneous coronary intervention, PCI. Methods: a retrospective cohort study was performed in a hospital in northern China. A total of 1033 older patients with first-ever AMI who underwent PCI between January 2018 and April 2021 were screened for delirium using the CMICU method. Clinical and laboratory data were collected. Results: a total of 134, 12.97%, patients were diagnosed with delirium. Patients with delirium were older. The most common concomitant diseases were cardiac arrest, chronic renal failure, and a history of coronary artery bypass graft, CABG. Delirious patients experienced more times of mechanical ventilation, more intra-aortic balloon pump, IABP, support, high postoperative immediate pain score, VS, more non-bedside cardiac rehabilitation, and longer total length of stay and cardiac care unit, CCU, time. Multivariable logistic regression showed that age, mechanical ventilation, postoperative immediate pain score, and non-bedside cardiac rehabilitation were independently associated with delirium. Delirium was an independent predictor of prolonged CCU stay, total length of stay, and 1-year mortality. Conclusion: age, mechanical ventilation, postoperative immediate pain score, and non-bedside cardiac rehabilitation were independently closely related to delirium in older patients with first-ever AMI who underwent PCI. Delirium was associated with a higher 1-year all-cause mortality. PMID 388294338DI 10.1007/S00059-024-05. J Addict Med 2024 June 3rd. DOI 10.1097/ADM.000000000000001314. Online ahead of print. Abstract. Kava consumption is a traditional practice in Polynesian and Micronesian cultures. It has recently gained popularity in the United States for therapeutic and recreational use. We report the following case. A man presented to the emergency department after a fall while intoxicated on kava. He was medically admitted for altered mental status, facial and clavicle fractures, and hyponatremia. Psychiatry was consulted for management of delirium. On interview, he reported consuming escalating amounts of kava for weeks despite attempts to stop. He was diagnosed with acute kava withdrawal with hyperactive delirium, treated with phenobarbital load, 860 milligrams, and taper, 390 milligrams. Continuous dexmedetomidine drip to hospital. Day 3 treated sympathetic activation and breakthrough agitation. By day 4, his delirium resolved and remained in remission until discharge. We performed a systematic review for reports of kava withdrawal, returning 9 studies. 8 assessed withdrawal symptoms after cessation of a low-controlled dose of kava extract with no symptoms noted. 1 reported a case series of heavy kava users with seizure-like events. No publications discuss treatment of kava withdrawal. To our knowledge, this is the first publication to describe kava withdrawal syndrome and its effective treatment with phenobarbital. PMID 388290029 DOI 10.1097/ADM.000000000000001314. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Kava withdrawal treated with phenobarbital. Case report and literature review. Title. VR-related evidence matrix. Continuous alcohol withdrawal delirium and physical illness-associated delirium in a man brought to the emergency department after a disaster, a case report. Treatment of anticholinergic delirium with oral rivastigmine, a case report. Treatment of anticholinergic delirium with oral rivastigmine, a case report. Treatment of anticholinergic delirium with oral rivastigmine, a case report. The ASAM/AAP Clinical Practice Guideline on the Management of Stimulant Use Disorder. High-dose buprenorphine initiation, a scoping review. Management of maxillofacial trauma in pregnant women. Posterior reversible encephalopathy syndrome presenting as delirium with psychosis and agitation in the postpartum period. A rare cause of empyema and bacteremia due to Schwannella species in alcoholic Interpretable machine learning model for early prediction of delirium in elderly patients following intensive care unit admission, a derivation and validation study. June 3, 2024. Evidence. Front Med, Lausanne. 2024 May 17, 11:1399848. doi 10.3389/med.2024.1399848. eCollection 2024. Abstract. Background and objective. Delirium is the most common neuropsychological complication among older adults admitted to the intensive care unit, ICU, and is often associated with a poor prognosis. This study aimed to construct and validate an interpretable machine learning, ML, for early delirium prediction in older ICU patients. Methods. This was a retrospective observational cohort study, and patient data were extracted from the Medical Information Mart for Intensive Care 4 database. Feature variables associated with delirium, including predisposing factors, disease-related factors, and iatrogenic and environmental factors, were selected using least absolute shrinkage and selection operator regression. And prediction models were built using logistic regression, decision trees, support vector machines, extreme gradient boosting, XGBoost, k-nearest neighbors, and naive Bayes methods. Multiple metrics were used for evaluation of performance of the models, including the area under the receiver operating characteristic curve, AUC, accuracy, sensitivity, specificity, recall, F1 score, calibration plot, and decision curve analysis. Shapley additive explanations, SHAP, were used to improve the interpretability of the final model. Results. 9,748 adults aged 65 years or older were included for analysis. 26 features were selected to construct ML prediction models. Among the models compared, the XGBoost model demonstrated the best performance, including the highest AUC, 0.836, accuracy, 0.765, sensitivity, 0.713, recall, 0.713, and F1 score, 0.725, in the training set. It also exhibited excellent discrimination with AUC of 0.810, good calibration, and had the highest net benefit in the validation cohort. The SHAP summary analysis showed that Glasgow Coma Scale, mechanical ventilation, and sedation were the top 3 risk features for outcome prediction. The SHAP dependency plot and SHAP force analysis interpreted the model at both the factor level and individual level, respectively. Conclusion. ML is a reliable tool for predicting the risk of critical delirium in elderly patients. By combining XGBoost and SHAP, it can provide clear explanations for personalized risk prediction and more intuitive understanding of the effect of key features in the model. The establishment of such a model would facilitate the early risk assessment and prompt intervention for delirium. PMID 388282233 PMC PMC 111400063 DOI 10.3389/med.2024.1399848. Document the CPD share evidence. Estimated reading time. Effects of intranasal insulin pretreatment on preoperative sleep quality and postoperative delirium in patients undergoing valve replacement for rheumatic heart disease. June 3, 2024. Evidence. NATSI Sleep. 2024 May 29, 16:613-623. doi 10.2147/NSS S439703. E-Collection 2024. Abstract. Background. Postoperative delirium, POD, is a common neurological complication associated with valve replacement. Preoperative sleep disturbance is a risk factor for POD development, and nasal insulin modulates the sleep-wake cycle. This study investigated the beneficial effects of intranasal insulin pretreatment on preoperative sleep quality and reducing POD in patients undergoing valve replacement for rheumatic heart disease. Patients and methods. This prospective, single-center, randomized controlled trial, RCT, included 76 adult patients aged 18 to 65 years undergoing valve surgery with cardiopulmonary bypass who were randomly allocated to receive intranasal insulin or normal saline interventions 2 days before surgery. POD incidence was on postoperative days 1, T3, 2, T4, and 3, T5. Before the first intervention, T0, 1D before surgery, T1, and before anesthesia on the day of surgery, T2, sleep quality was assessed and serum cortisol concentrations were measured. At T1 and T2, sleep quality-related indicators monitored by sleep monitoring watches from the previous night were recorded. Results. Compared with the normal saline group, 3 days after surgery, the insulin group showed a significantly reduced incidence of POD, significantly increased deep sleep, REM sleep, deep sleep continuity, and total sleep quality scores at T1 and T2, and significantly reduced serum cortisol concentration, PSQI scale, light sleep ratio, and wakefulness at T1 and T2. Conclusion. The administration of 20 U of intranasal insulin twice daily, from 2 days preoperatively until 10 minutes pre-anesthesia on the day of surgery, can improve preoperative sleep quality significantly and reduced POD incidence in patients with rheumatic heart disease undergoing valve replacement. Clinical trial registration. This study was registered with the Chinese Clinical Trial Registry, www.xiktr.org.cn, with the unique identifier CCTR 2100048515, July 9, 2021. PMID 388273992 PMC, PMC 1114443 DOI, 10.2147/NSS, S439703. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Effects of intranasal insulin pretreatment on preoperative sleep quality. Effect of telemedicine support for intraoperative anesthesia care on postoperative outcomes, the Tectonics randomized clinical trial. June 3, 2024. Evidence. MedRxiv preprint. 2024 May 23:20.05.21.24307593. DOI 10.1101/2024.05.21.24307593. Abstract. Background. Novel applications of telemedicine can improve care quality and patient outcomes. Telemedicine for intraoperative decision support has not been rigorously studied. Methods. This single-center randomized clinical trials Gov NCT 0392369 of unselected adult surgical patients was conducted between July 1, 2019 and January 31, 2023. Patients received usual care or decision support from a telemedicine service, the Anesthesiology Control Tower, ACT. The ACT provided real-time recommendations to intraoperative anesthesia clinicians based on case reviews, machine learning forecasting, and physiologic alerts. ORs were randomized 1:1. Co-primary outcomes of 30-day all-cause mortality, respiratory failure, acute kidney injury, AKI, and delirium were analyzed as intention to treat. Results. The trial completed planned enrollment with 71,927 surgeries, 35,956 ACT, 35971 usual care. After multiple testing correction, there was no significant effect of the ACT versus usual care on 30-day mortality, 641/35956, 1.8%, versus 638/35971, 1.8%. Risk difference 0%, 95% CI minus 0.2% to 0.3%, P equals 0.96, respiratory failure, 1089/34613, 3.1%, versus 1112/34619, 3.2%, risk difference minus 0.1%, 95% CI minus 0.4% to 0.3%. P equals 0.96, AKI, 2357/33897, 7%, versus 2391/33795, 7.1%, risk difference minus 0.1%, minus 0.6% to 0.4%, P equals 0.96, or delirium, 1283/3928, 32.7%, versus 1279/3989, 32.1%, risk difference 0.6%, minus 2.0% to 3.2%, P equals 0.96. There were no significant differences in secondary outcomes or in sensitivity analyses. Conclusions. In this large RCT of a novel application of telemedicine-based remote monitoring and decision support using real-time alerts and case reviews, we found no significant differences in postoperative outcomes. Large-scale intraoperative telemedicine is feasible, and we suggest future avenues where it may be impactful. CME. CN Case Republic 2024 June 2nd. DOI 10.17007/S13730-024-00896. W. Online ahead of print. Abstract. Progressive multifocal leukoencephalopathy, PML, a severe demyelinating disease of the central nervous system, is caused by the reactivation of the polyomavirus JC virus, JCV. It favors the cerebrum and typically occurs in patients with immunodeficiencies, with a progressive course and fatal outcome in the majority of cases. However, the cerebellar form of PML, characterized by isolated posterior fossa lesions, such as those in the cerebellum or brainstem at disease onset, is rare, and reports of its occurrence in peritoneal dialysis, PD, patients are lacking. In this paper, we describe a rare case of a cerebellar form of PML in a PD patient. A 64-year-old man undergoing PD was referred to our hospital for anorexia, nausea, and vomiting in the past month. He had finger-to-nose test abnormalities, gaze-directed nystagmus, and scanning speech. He was diagnosed with the cerebellar form of PML based on his progressive cerebellar symptoms, the typical magnetic resonance imaging findings, and the presence of JCV DNA in the cerebrospinal fluid polymerase chain reaction test. He developed nocturnal delirium, aggravated disquiet, and died of pneumonia on the 69th day. Clinicians should consider the cerebellar form of PML as a differential diagnosis if PD patients develop progressive cerebellar symptoms. PMID 38824484DOI 10.1007/S13730-024-00896 W. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. A case of a cerebellar form of progressive multifocal leukoencephalopathy in a patient undergoing peritoneal dialysis. Title: VR-related evidence matrix. A case of a cerebellar form of progressive multifocal leukoencephalopathy in a patient undergoing peritoneal dialysis. Combining hemodialysis with peritoneal dialysis improves cognitive function, a 3-case report. Primary central nervous system lymphoma, imaging features and differential diagnosis. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. When prion disease isn't suspected, prion disease as the cause of terminal decline in chronic mixed dementia. Preoperative cognitive performance and its association with postoperative complications in vascular surgery patients, a prospective study. June 3, 2024. Evidence. JSURG, 2024 May 28:115784. DOI 10.1016/Jade, AMSURG.2024.115784. Online ahead of print. Abstract. Background. Cognitive impairment affects nearly half of vascular surgery patients, but its association with postoperative outcomes remains poorly understood. This study explores the link between preoperative cognitive performance and postoperative complications, including postoperative delirium, in vascular surgery patients. Methods. A prospective cohort study was conducted on vascular surgery patients aged greater than or equal to 65. Preoperative cognitive performance was assessed using the Montreal Cognitive Assessment, and postoperative complications were evaluated using the Comprehensive Complication Index. The association was analyzed through multivariable logistic regression. Results. Among 110 patients, 18.2% female, mean age 73.8 plus or minus 5.7 years, cognitive impairment was evident in 48.2%. Of the participants, 26.3%, experienced postoperative complications, among which 10%, experienced postoperative delirium. The adjusted odds ratio for the association between cognitive performance and postoperative complications was 1.19, 95% CI 1.02 to 1.38, p equals 0.02. Conclusion: worse preoperative cognitive performance correlated with increased odds of postoperative complications and postoperative delirium in vascular surgery patients. PMID 38824053 DOI 10.1016/JADE AMSURG.2024.115784. Document the CPD share evidence. Estimated reading time 3 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Preoperative cognitive performance and its association with postoperative complications in vascular surgery patients, a prospective study. Title: VR-related evidence matrix. Preoperative cognitive performance and its association with postoperative complications in vascular surgery patients, a prospective study. Postoperative cognitive dysfunction, review of pathophysiology, diagnostics, and preventive strategies. Association between postoperative hyperactive delirium and major complications in elderly patients undergoing emergency hip fracture surgery, a large-scale cohort study. Association between preoperative anxiety states and postoperative complications in patients with esophageal cancer and CPD, a retrospective cohort study. The effects of empiric antibiotic regimens in adults with non-ventilator-associated hospital-acquired pneumonia, a systematic review and network meta-analysis of randomized controlled trials. June 3, 2024. Evidence. Clin Microbial Infect. 2024 May 30, S1198-743X, 24, 00254-4. DOI 10.1016/JADE CMI.2024.05.017. Online ahead of print. Abstract. Background: the optimal empiric antibiotic regimen for non-ventilator-associated hospital-acquired pneumonia, HAP, is uncertain. Objectives: to compare alternative empiric antibiotic regimens in HAP using a network meta-analysis, NMA. Methods: data sources, Medline, Embase, Cochrane Central, Web of Science, and CINAHL from database inception to July 6, 2023. Study eligibility criteria, randomized controlled trials, RCT. Participants: adults with clinical suspicion of HAP. Intervention: any empiric antibiotic regimen versus another, placebo or no treatment. Assessment of risk of bias: paired reviewers independently assessed risk of bias using a modified Cochrane tool for assessing risk of bias in randomized trials. Methods of data analysis: paired reviewers independently extracted data on trial and patient characteristics, antibiotic regimens, and outcomes of interest. We conducted frequentist random effects NMAs for treatment failure and all-cause mortality and assessed the certainty of the evidence using the grading of recommendations assessment, development and evaluation, GRADE, approach. Results: 39 trials proved eligible. 30 RCTs involving 4,807 participants found low-certainty evidence that piperacillin-tazobactam, RR compared to all cephalosporins, 0.65, 95% CI, 0.42, 1.01, and carbapenems, RR compared to all cephalosporins, 0.77, 95% CI, 0.53, 1.11, might be among the most effective in reducing treatment failure. The findings were robust to the secondary analysis comparing piperacillin-tazobactam versus antipsydominal cephalosporins or antipsydominal carbapenems versus antipsydominal cephalosporins. 11 RCTs involving 2,531 participants found low-certainty evidence that ceftazidime and linezolid combination may not be convincingly different from cephalosporin alone in reducing all-cause mortality. Evidence on other antibiotic regimens is very uncertain. Data on other patient-important outcomes, including adverse events, was sparse, and we did not perform network or pairwise meta-analysis. Conclusions. For empiric antibiotic therapy of adults with HAP, piperacillin-tazobactam might be among the most effective in reducing treatment failure in HAP. Empiric MRSA coverage may not exert additional benefit in reducing mortality in HAP. Registration. Prospero, CRD 4202-229-7224. PMID 38823. CN Case Republic 2024 June 2nd. DOI 10.1370/S13730-024-00896. W. Online ahead of print. Abstract. Progressive multifocal leukoencephalopathy, PML, a severe demyelinating disease of the central nervous system, is caused by the reactivation of the polyomavirus JC virus, JCV. It favors the cerebrum and typically occurs in patients with immunodeficiencies, with a progressive course and fatal outcome in the majority of cases. However, the cerebellar form of PML, characterized by isolated posterior fossa lesions, such as those in the cerebellum or brainstem at disease onset, is rare, and reports of its occurrence in peritoneal dialysis, PD, patients are lacking. In this paper, we describe a rare case of a cerebellar form of PML in a PD patient. A 64-year-old man undergoing PD was referred to our hospital for anorexia, nausea, and vomiting in the past month. He had finger-to-nose test abnormalities, gaze-directed nystagmus, and scanning speech. He was diagnosed with a cerebellar form of PML based on his progressive cerebellar symptoms, the typical magnetic resonance imaging findings, and the presence of JCV DNA in the cerebrospinal fluid polymerase chain reaction test. He developed nocturnal delirium, aggravated disquiet, and died of pneumonia on the 69th day. Clinicians should consider the cerebellar form of PML as a differential diagnosis if PD patients develop progressive cerebellar symptoms. PMID 388244484 DOI 10.1770/S13730-024-00896. W. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. A case of a cerebellar form of progressive multifocal leukoencephalopathy in a patient undergoing peritoneal dialysis. Title: VR-related evidence matrix. Combining hemodialysis with peritoneal dialysis improves cognitive function, a 3-case report. Primary central nervous system lymphoma, imaging features and differential diagnosis. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. Hypertensive emergency due to a delayed dialysis modality transition in a patient with familial hypomagnesemia with hypercalciuria and nephrocalcinosis, a case report. When prion disease isn't suspected, prion disease as the cause of terminal decline in chronic mixed dementia. PML restrains p53 activity and cellular senescence in clear preoperative cognitive performance and its association with postoperative complications in vascular surgery patients, a prospective study. June 2, 2024. Evidence. JSURG, 2024 May 28:115784. doi 10.1016/jade amsurg.2024.115784. Online ahead of print. Abstract. Background. Cognitive impairment affects nearly half of vascular surgery patients, but its association with postoperative outcomes remains poorly understood. This study explores the link between preoperative cognitive performance and postoperative complications, including postoperative delirium, in vascular surgery patients. Methods. A prospective cohort study was conducted on vascular surgery patients aged greater than or equal to 65. Preoperative cognitive performance was assessed using the Montreal Cognitive Assessment, and postoperative complications were evaluated using the Comprehensive Complication Index. The association was analyzed through multivariable logistic regression. Results. Among 110 patients, 18.2% female, mean age 73.8 plus or minus 5.7 years, cognitive impairment was evident in 48.2%. Of the participants, 26.3%, experienced postoperative complications, among which 10%, experienced postoperative delirium. The adjusted odds ratio for the association between cognitive performance and postoperative complications was 1.19, 95% CI 1.02 to 1.38, p equals 0.02. Conclusion. Worse preoperative cognitive performance correlated with increased odds of postoperative complications and postoperative delirium in vascular surgery patients. PMID 38824053 DOI 10.1016/jade amsurg.2024.115784. Document the CPD share evidence. Estimated reading time, 3 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Preoperative cognitive performance and its association with postoperative complications in vascular surgery patients, a prospective study. Title. VR-related evidence matrix. Postoperative cognitive dysfunction, review of pathophysiology, diagnostics, and preventive strategies. Association between postoperative hyperactive delirium and major complications in elderly patients undergoing emergency hip fracture surgery, a large-scale cohort study. Association between preoperative anxiety states and postoperative complications in patients with esophageal cancer and CPD, a retrospective cohort study. Preoperative ketamine administration for prevention of postoperative neurocognitive disorders after major orthopedic surgery in elderly patients, a multi-center random. The effects of empiric antibiotic regimens in adults with non-ventilator-associated hospital-acquired pneumonia, a systematic review and network meta-analysis of randomized controlled trials. June 2, 2024. Evidence. Clin Microbial Infect. 2024 May 30, S1198-743X, 24, 00254-4. doi 10.1016/jade, CMI.2024.05.017. Online ahead of print. Abstract. Background. The optimal empiric antibiotic regimen for non-ventilator-associated hospital-acquired pneumonia, HAP, is uncertain. Objectives: to compare alternative empiric antibiotic regimens in HAP using a network meta-analysis, NMA. Methods: data sources, Medline, Embase, Cochrane Central, Web of Science, and CINAHL from database inception to July 6, 2023. Study eligibility criteria, randomized controlled trials, RCT. Participants: adults with clinical suspicion of HAP. Intervention: any empiric antibiotic regimen versus another, placebo or no treatment. Assessment of risk of bias. Paired reviewers independently assessed risk of bias using a modified Cochrane tool for assessing risk of bias in randomized trials. Methods of data analysis. Paired reviewers independently extracted data on trial and patient characteristics, antibiotic regimens, and outcomes of interest. We conducted frequentist random effects (NMEs) for treatment failure and all-cause mortality and assessed the certainty of the evidence using the grading of recommendations assessment, development and evaluation, GRADE, approach. Results: 39 trials proved eligible. 30 RCTs involving 4,807 participants found low certainty evidence that piperacillin-tazobactam, RR compared to all cephalosporins, 0.65, 95% CI, 0.42, 1.01, and carbapenems, RR compared to all cephalosporins, 0.77, 95% CI, 0.53, 1.11, might be among the most effective in reducing treatment failure. The findings were robust to the secondary analysis comparing piperacillin-tazobactam versus antipsydominal cephalosporins or antipsydominal carbapenems versus antipsydominal cephalosporins. 11 RCTs involving 2,531 participants found low certainty evidence that ceftazidime and linezolid combination may not be convincingly different from cephalosporin alone in reducing all-cause mortality. Evidence on other antibiotic regimens is very uncertain. Data on other patient-important outcomes including adverse events was sparse, and we did not perform network or pairwise meta-analysis. Conclusions. For empiric antibiotic therapy of adults with HAP, piperacillin-tazobactam might be among the most effective in reducing treatment failure in HAP. Empiric MRSA coverage may not exert additional benefit in reducing mortality in HAP. Registration: Prospero, CRD 4202-229-7224. J. Klinnaz. May 31st, 2024. DOI 10.1111/Jochen.17298. Online ahead of print. Abstract. AM. To determine the frequency of sepsis-associated delirium, SAD, in the intensive care unit and its effect on nurse workload. Design. A cross-sectional and correlational design was used. Methods. The study was conducted with 158 patients in the adult intensive care unit of a hospital between October 28 and July 28, 2022. Data analysis included frequency, chi-squared/Fisher's exact test, independent samples t-test, correlation analysis, simple and multiple linear regression analyses. The study adhered to the Strobe guidelines. Results: sepsis was detected in 12.7% of the patients, delirium in 39.9%, and SAD in 10.1%. SAD was more common in males, 19%, and 56.3% of the patients were admitted to the unit from the emergency department. Patients developing SAD had significantly higher age and mean sequential organ failure evaluation, acute physiology and chronic health evaluation 2, and C-reactive protein and lactate scores, but their Glasgow Coma Scale scores were significantly low. There was a moderate positive relationship between the patient's sequential organ failure assessment score and the presence of SAD. The most common source of infection in patients diagnosed with SAD was bloodstream infection, 44.4%. SAD significantly increased nurse workload and average care time, 1.8h, and it explained 22.8% of the total variance in nurse workload. Additionally, the use of antibiotics, vasopressors, and invasive mechanical ventilation significantly increased nurse workload. Conclusion: in the study, in patients who developed SAD, increased nurse workload and average care time significantly. Preventive nursing approaches and effective management of SAD can reduce the rate of development of SAD and nurse workload. Implications for the profession and patient care. It is important to work with routine screening, prevention, and patient-nurse ratio appropriate to the workload for SAD. PMID 38822-493 DOI 10.1111/Jochen.17298. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. The frequency of sepsis-associated delirium in intensive care unit and its effect on nurse workload. Title: VR-related evidence matrix. The role of heart rate variability in predicting delirium, a systematic review and meta-analysis. Efficacy of melatonin in decreasing the incidence of delirium in critically ill adults, a randomized controlled trial. Efficacy of melatonin in decreasing the incidence of delirium in critically ill adults, a randomized controlled trial. The predictive value of confusion assessment method in Effects of different doses of intranasal dexmedetomidine on related complications and parent satisfaction in anesthetized children, a systematic review. June 1, 2024. Evidence. BMC Pediater. 2024 May 31, 24, 1377. DOI 10.1186/S12887-024-04832. W. Abstract. Background. Agitation/delirium is commonly seen in children after anesthesia, and a proper dose of dexmedetomidine can prevent this complication. This study aimed to investigate the effects of different doses of dexmedetomidine, DX, on agitation/delirium and other complications in anesthetized children, providing clinical evidence for dose recommendations of DX. Methods. This study was conducted based on the preferred reporting items for systematic reviews and meta-analyses, PRISMA. A systematic search was conducted in the Cochrane Library, PubMed, Web of Science, and Embase. 2 independent researchers performed literature screening, data extraction, and assessed the methodological quality. Data analysis was conducted using R and Stata 16.0. Results. In the final analysis, 20 randomized controlled trials, RCTs, involving 2,521 children were included. The results showed that in comparison to normal saline, 1g/kg, 1.5g/kg, and 2g/kg intranasal DX significantly reduced the incidence of post-anesthetic emergence agitation in children, with the most effective dose being 2g/kg, sucra equals 0.91. Compared with normal saline, 1g/kg, 1.5g/kg, and 2g/kg intranasal DX reduced patients' need for postoperative analgesia, with the most effective dose being 1.5g/kg. Sucra equals 0.78. However, 1g/kg DX performed the best in reducing pediatric anesthesia emergence delirium, PED, scale score, sucra equals 0.88. Conclusion. Compared with normal saline, intranasal administration of 2g/kg DX and 1.5g/kg DX are the optimal doses to reduce the incidence of agitation and the need for postoperative pain relief in children under general anesthesia. Given effectiveness and safety, intranasal use of 1g/kg DX appears to be the most effective dosage for anesthetized children. PMID 3882215 DOI 10.1186/S12887-024-04832. W. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Effects of different doses of intranasal dexmedetomidine on related complications and parent satisfaction in anesthetized. Preventive effects of Rameltian, suvorexant, and lemborexant on delirium in hospitalized patients with physical disease, a retrospective cohort study. June 1, 2024. Evidence. J. Clin Psychopharmacol. 2024 June 3. DOI 10.1097/JCP.000000000000000186. Online ahead of print. Abstract. Background. New sleep-inducing drugs, e.g., Ramelteon, suvorexant, and lemborexant, have been shown to prevent delirium in high-risk groups. However, no single study has simultaneously evaluated the delirium-preventing effects of all novel sleep-inducing drugs in hospitalized patients. Therefore, this study aimed to clarify the relationship between sleep-inducing drugs and delirium prevention in patients hospitalized in general medical surgical settings for non-psychiatric conditions who underwent liaison interventions for insomnia. Methods. This retrospective cohort study included patients treated in general medical surgical settings for non-psychiatric conditions with consultation liaison psychiatry consult for insomnia. Delirium was diagnosed by fully certified psychiatrists using the Diagnostic and Statistical Manual of Mental Disorders 5th edition. The following items were retrospectively examined from medical records as factors related to delirium development: type of sleep-inducing drugs, age, sex, and delirium risk factors. The risk factors of delirium development were calculated using adjusted odds ratios, hours, by a multivariate logistic regression analysis. Results. Among the 710 patients analyzed, 257, 36.2%, developed delirium. Suvorexant, hour, 0.61, 95% confidence interval, CI, 0.40 to 0.94, p equals 0.02, and lemborexant, hour, 0.23, 95% CI, 0.14 to 0.39, p less than 0.0001, significantly reduced the risk of developing delirium. Benzodiazepines, hour, 1.90, 95% CI, 1.15 to 3.13, p equals 0.01, significantly increased this risk. Ramelteon, hour, 1.30, 95% CI, 0.84 to 2.01, p equals 0.24, and Z-drugs, hour, 1.27, 95% CI, 0.81 to 1.98, p equals 0.30, were not significantly associated with delirium development. Conclusions. The use of suvorexant and lemborexant may prevent delirium in patients with a wide range of medical conditions. PMID 3882037 doi 10.1097/JCP.0000000000000186. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. IRJ MedSci, May 31, 2024. DOI 10.1007/S11845-024-03692-8. Online ahead of print. Abstract. Background. Acute, transient, but sometimes persistent, delirium is characterized by a sharp disruption in attention, consciousness, and cognitive function, and can be caused by many medications and disorders. Delirium occurrence and negative consequences, such as falls and functional decline, can be decreased with multifactorial prevention and timely detection. AMS, to describe current clinical practice in relation to the prevention, assessment, and management of delirium in Irish hospitals, awareness raising and educational activities, and barriers to good practice. Methods. On World Delirium Awareness Day, March 15, 2023, a global survey was conducted of delirium prevalence and care. A senior clinical staff member on each participating ward reported on delirium prevalence at 8 a.m. and 8 p.m. and unusual ward practice. This data was entered into an online survey by a data collector, typically a clinician from the site, visiting several wards to record data. This study reports data from Irish hospitals. Results. In total, 132 wards from 15 hospitals across Ireland participated. Almost 60% of wards used personal judgment for delirium assessment. Having at least one delirium training session in the preceding year was associated with greater use of a formal assessment tool, 60.3% versus 18.8%, p less than 0.001. Wards reported staff training/education as the main priority to improve care, but 72.7% of wards identified insufficient time to train staff as a key barrier. Conclusions. Clinical practice related to delirium care requires improvement. Awareness raising and staff training require more focus and time in busy clinical settings. PMID 388197333DOI 10.1007/S1184-024-03692-8. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Delirium care in hospitals in Ireland on World Delirium Awareness Day 2023. Title: VR-related evidence matrix. Intensive care nurses' perceptions and awareness of delirium and delirium prevention guidelines. Co-design and mixed methods evaluation of an interdisciplinary digital resource for undergraduate health profession students to improve the prevention, recognition, and management of delirium in Ireland, a study protocol. Nursing experiences and knowledge of pediatric delirium, analyzing knowledge practice gaps. Attitudes, knowledge, and practices concerning delirium. Variation in care and outcome for fragile hip fracture patients, a European multi-center study benchmarking fulfillment of established quality indicators. May 31, 2024. Evidence. URG Trauma Emergency SURG, May 31, 2024. DOI 10.1007/S00068-024-02549-0. Online ahead of print. Abstract. Purpose. Despite the availability of clinical guidelines for hip fracture patients, adherence to these guidelines is challenging, potentially resulting in suboptimal patient care. The goal of this study was 1. To evaluate and benchmark the adherence to recently established quality indicators, QIs, and 2. To study clinical outcomes in fragile hip fracture patients from different European countries. Methods. This observational, cross-sectional multi-center study was performed in 10 hospitals from 9 European countries, including data of 298 consecutive patients. Results: a large variation both within and between hospitals were seen regarding adherence to the individual QIs. QIs with the lowest overall adherence rates were the administration of systemic steroids, 5.4%, and tranexamic acid, 20.1%. Indicators with the highest adherence rates, above 95%, were preoperative, 99.3%, and postoperative hemoglobin level assessment, 100%. The overall median time to surgery was 22.6 h, range 15.7 to 42.5 h. The median LOS was 9.0 days, range 5.0 to 19.0 days. The most common complications were delirium, 23.2%, and post-surgical constipation, 25.2%. Conclusion: the present study shows large variation in the care for fragile patients with hip fractures, indicating room for improvement. Therefore, hospitals should invest in benchmarking and knowledge sharing. Large quality improvement initiatives with longitudinal follow-up of both process and outcome indicators should be initiated. CME 3881967 10.1007/S00068-024-02549-0. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Variation in care and outcome for fragile hip fracture patients, a European multi-center study benchmarking fulfillment of established quality indicators. Title: VR-related evidence matrix. Adherence to and clinical utility of quality indicators for Staphylococcus aureus bacteremia, a retrospective, multi-center study. Outcomes following hip fracture surgery in adults with schizophrenia in Ontario, Canada, a 10-year population-based retrospective cohort study. Correspondence on recognition and management of delirium in the neonatal intensive care unit, case series from a single center level 4 intensive care unit. May 31, 2024. Evidence. J. Child Neural, 2024 May 31:880738241259054. DOI 10.1177/08830738241259054. Online ahead of print. No abstract. CME 3881935 DOI 10.1177/08830738241259054. Document the CPD share evidence. Estimated reading time, 1 minute. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Correspondence on recognition and management of delirium in the neonatal intensive care unit, case series from a single center level 4 intensive care unit. Title: VR-related evidence matrix. Recognition and management of delirium in the neonatal intensive care unit. Case series from a single center level 4 intensive care unit. Effects of Web Neonatal Intensive Care Unit diaries on the mental health, quality of life, sleep quality, careability, and hormone levels of parents of preterm infants in the neonatal intensive care unit, a randomized controlled trial. The effect of neonatal intensive care nurses' attitudes towards palliative care on death anxiety and burnout, an analytic cross-sectional study. Nursing care of a child with delirium receiving veno-arterial extracorporeal membrane oxygenation, a case report. Efficacy of melatonin in decreasing the incidence of delirium in critically ill adults, a randomized controlled trial. Efficacy of melatonin in decreasing the incidence of delirium in critically ill adults, a randomized controlled trial. Delirium associated with COVID-19 in critically ill children, an observational cohort study. Music therapy in tertiary neonatal intensive care, a matter of unlikely allies? 2 months outcomes following delirium in the pediatric intensive care unit. Dexmedetomidine in palliative care, a versatile new weapon against delirium and pain. Systematic review. The predictive value of confusion assessment method intensive care unit and intensive care delirium screening checklist for delirium in critically ill patients in the intensive care unit, a systematic review and meta-analysis. The role of heart rate variability in predicting delirium, a systematic review and meta-analysis. Beyond the brain, general intensive care considerations in pediatric neurocritical care. Impact of delirium onset and duration on mortality in patients with cancer admitted to the ICU. Front Med, Lausanne. 2024 May 16, 11:1346354. doi 10.3389/med.2024.134634. Ecollection 2024. Abstract. Purpose: pelvic fracture, PF, is common, especially among older patients, and its prevalence increases over time. In contrast to hip fracture, HF, the literature on rehabilitation after PF is scant, mandating a study of the outcomes of rehabilitation in patients with PF. The present study compared patients who underwent intensive rehabilitation following HF or PF. Methods: a retrospective study of patients 65 years of age and older who underwent intensive rehabilitation in the geriatrics department. Data were collected on patients with PF, while data on patients with HF were taken from an earlier study. All patients in both groups suffered from low-energy trauma. Rehabilitation outcomes were measured using the Montebello Rehabilitation Factor Score Revised, MRS-FAR. Results: 144 PF patients were compared with 138 HF patients. The mean age of the patients in the HF group was 82.5 plus or minus 7.1 compared to 81.5 plus or minus 6.9 in the PF group, p equals 0.230. Females comprised 77.5% of the patients in the HF group and 90.3% in the PF group, p equals 0.04. All patients in the HF group underwent surgical repair of their fracture, while all patients in the PF group had non-surgical treatment. More patients in the HF sample had a nursing caregiver prior to the fracture, 92% versus 60.4%, p less than 0.001, had a higher Charlson Comorbidity Index total score, 2.1 plus or minus 1.9 versus 1.6 plus or minus 1.7, p equals 0.13, developed more delirium, 21.7% versus 8.3%, p equals 0.16. More infections, 29% versus 11.1%, p less than 0.002, and more cardiovascular complications, 23.9% versus 5.6%, p less than 0.001, during hospitalization. They had longer hospital stays, 20.9 plus or minus 7.5 versus 18.2 plus or minus 7.7 days, p equals 0.0007, and had a higher mortality rate, 13.8% versus 6.3%, p equals 0.037, over the first year following the fracture than the PF group. A similar rate of patients in both groups, 64.5% versus 60.4%, p equals 0.483, had successful intensive rehabilitation. In the PF group, only cognitive state was an independent predictor of successful rehabilitation, with each additional point in the mini mental state examination, MMSE, increasing the patient's chance of reaching an MRFSR score greater than or equal to 50 by 20.5%. Conclusion: despite slightly different characteristics in the two groups, the results of intensive rehabilitation were similar. Cognitive state was the only independent factor that affected achievement of a better rehabilitation outcome. With the increasing rate of PF, more studies should focus on rehabilitation in this patient population. PMID. Brain We Have Immune Health. 2024 May 3, 38:100788. DOI 10.1016/J by point 2024.100788. E-collection 2024 July. Abstract. Coronavirus disease 2019, COVID-19, vaccination has become the most effective countermeasure in the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, pandemic. However, vaccination is associated with side effects. This narrative review focuses on central nervous system, CNS, manifestations following COVID-19 vaccination and provides a summary of the potential underlying mechanisms and methods of diagnosis and management of the vaccination-related CNS manifestations. Headache, myalgia, optic neuritis, seizure, multiple sclerosis, acute disseminated encephalomyelitis and encephalitis, delirium, acute transverse myelitis, and stroke have been reported after COVID-19 vaccination. Constant headache and myalgia are common manifestations that may necessitate further clinical investigation for stroke. To limit consequences, it is imperative to follow standard treatment protocols for each neurological disorder following COVID-19 vaccination. Immunosuppressive medication can be helpful in the treatment of seizures following vaccination since the immune response is involved in their etiology. Clinicians should be aware of the manifestations after COVID-19 vaccination to respond promptly and effectively. Clinical guidelines for the management of CNS manifestations following COVID-19 vaccination are in high demand and would be useful in each new SARS-CoV-2 variant pandemic. PMID 3881837 PMC, PMC 11137405 DOI, 10.1016/J, by point 2024.100788. Document the CPD share evidence. Estimated reading time, 4 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Central nervous system manifestations following vaccination against COVID-19. Title: VR-related evidence matrix. Neuropsychiatric symptoms associated with the COVID-19 and its potential nervous system infection mechanism, the role of imaging in the study. Factors associated with SARS-CoV-2 vaccine hesitancy after stroke, a cross-sectional study. Implementation of COVID-19 vaccination services in prison in 6 European countries, translating emergency intervention into routine life course vaccination. Guillain-Barré syndrome following COVID-19 vaccination, a study of 70 case reports. Guillain-Barré syndrome following COVID-19 vaccination, a study of 70 case reports. Potential impact of annual vaccination with reformulated COVID-19 vaccines, lessons from the U.S. COVID-19 Scenario Modeling Hub. SARS-CoV COVID-19 vaccination may prevent postoperative delirium in elderly patients undergoing elective non-cardiac surgery, the PNFAP and PNDABLE studies. May 31, 2024. Evidence. Helion. 2024 May 7, 10, 10E30414. doi, 10.1016/J, Helion.2024, E30414. E-collection May 30, 2024. Abstract. Background. Postoperative delirium, POD, often occurs in elderly patients after surgery. We conducted 2 clinical studies to determine whether COVID-19 vaccination has a protective effect on POD and to explore the role of CSF biomarkers in this process. Methods. We conducted 2 clinical studies, perioperative neurocognitive disorder risk factor and prognosis, PNFAP, and perioperative neurocognitive disorder and biomarker lifestyle, PNDABLE, in which patients more than or equal to 65 years old who have had elective non-cardiac surgery were enrolled. The preoperative cognitive status of patients were evaluated by Mini-Mental State Examination, MMSE, 1 day preoperatively. Confusion Assessment Method, CM, was used to diagnose POD. We used the mediation model to analyze the relationship between CSF biomarkers, COVID-19 vaccination, and POD, as well as dynamic nomogram to calculate the incidence of non-postoperative delirium, NPOD. The main outcome of these studies was the incidence of POD during 7 days post-operatively or before discharge, which was assessed by CM. Results. In the final, 705 participants were enrolled in the PNFAP study and 638 patients in the PNDABLE. In both studies, we found that the occurrence of POD was lower in patients who had injected COVID-19 vaccination before surgery compared with those without vaccination, PNFAP, 10.2%, 21/205, versus 25.8%, 129 to 500, p less than 0.001, PNDABLE, 2.4%, 4/164, versus 34.6%, 164/474, p less than 0.001. Mediation analysis showed that the protective effect of preoperative COVID-19 vaccine on POD was significantly mediated by CSF A beta 4/2, proportion equals 17.56%, t-tau. Proportion equals 19.64%, A beta 42/t-tau, proportion equals 29.67%, and A beta 42/p-tau, proportion equals 12.26%. Conclusions. COVID-19 vaccine is a protective factor for POD in old patients, which is associated with CSF biomarkers. PMID 3881817 PMC, PMC 11137356 DOI 10.1016/J Helion.2024 E30414. Document the CPD share evidence. Estimated reading time 5 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence. Protocol for the Development and Analysis of the Oxford and Reading Cognitive Comorbidity, Frailty, and Aging Research Database Electronic Patient Records, Orchard EPR. May 31, 2024. Evidence. BMJ Open. 2024 May 30, 14, 5E085126. DOI 10.1136/Jopen 2024-085126. Abstract. Background. Hospital electronic patient records, EPRs, offer the opportunity to exploit large-scale, routinely acquired data at relatively low cost and without selection. EPRs provide considerably richer data and in real time than retrospective administrative datasets in which clinical complexity is often poorly captured. With population aging, a wide range of hospital specialties now manage older people with multimorbidity, frailty, and associated poor outcomes. We, therefore, set up the Oxford and Reading Cognitive Comorbidity, Frailty, and Aging Research Database Electronic Patient Records, Orchard EPR, to facilitate clinically meaningful research in older hospital patients, including algorithm development, and to aid medical decision-making, implementation of guidelines, and inform policy. Methods and analysis. Orchard EPR uses routinely acquired individual patient data on all patients aged greater than or equal to 65 years with unplanned admission or same-day emergency care unit attendance at 4 acute general hospitals serving a population of greater than 800,000, Oxfordshire, UK, with planned extension to the neighboring Berkshire regional hospitals, greater than 1,000. Data fields include diagnosis, comorbidities, nursing risk assessments, frailty, observations, illness acuity, laboratory tests, and brain scan images. Importantly, Orchard EPR contains the results from mandatory hospital-wide cognitive screening, greater than or equal to 70 years, comprising the 10-point abbreviated mental test and dementia and delirium diagnosis, confusion assessment method CM. Outcomes include length of stay, delayed transfers of care, discharge destination, readmissions, and death. The rich multimodal data are further enhanced by linkage to secondary care electronic mental health records. Selection of appropriate subgroups or linkage to existing cohorts allows disease-specific studies. Over 200,000 patient episodes are included to date, with data collection ongoing, of which 129,248 are admissions with a length of stay greater than or equal to 1 day in 64,641 unique patients. Ethics and dissemination. Orchard EPR is approved by the South Central Oxford C Research Ethics Committee, Ref. 23/SC/0258. Results will be widely disseminated through peer-reviewed publications and presentations at conferences and regional meetings to improve hospital data quality and clinical services. PMID 388160552 DOI 10.1136/Jopen 2024-085126. Document the CPD share evidence. Estimated reading time 6 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. World J Emergency SURG, 2024 May 31, 19, 118. DOI 10.1186/S13017-024-00537-8. Abstract. Background. The trauma mortality rate is higher in the elderly compared with younger patients. Aging is associated with physiological changes in multiple systems and correlated with frailty. Frailty is a risk factor for mortality in elderly trauma patients. We aim to provide evidence-based guidelines for the management of geriatric trauma patients to improve it and reduce futile procedures. Methods. 6 working groups of expert acute care and trauma surgeons reviewed extensively the literature according to the topic and the PICO question assigned. Statements and recommendations were assessed according to the grade methodology and approved by a consensus of experts in the field at the 10th International Congress of the WCS in 2023. Results. The management of elderly trauma patients requires knowledge of aging physiology, a focused triage, including drug history, frailty assessment, nutritional status, and early activation of trauma protocol to improve outcomes. Acute trauma pain in the elderly has to be managed in a multimodal analgesic approach to avoid side effects of opioid use. Antibiotic prophylaxis is recommended in penetrating, abdominal, thoracic, trauma, in severely burned and in open fractures elderly patients to decrease septic complications. Antibiotics are not recommended in blunt trauma in the absence of signs of sepsis and septic shock. Venous thromboembolism prophylaxis with LMWH or euphage should be administered as soon as possible in high and moderate risk elderly trauma patients according to the renal function, weight of the patient, and bleeding risk. A palliative care team should be involved as soon as possible to discuss the end of life in a multidisciplinary approach, considering the patient's directives, family feelings, and representatives' desires, and all decisions should be shared. Conclusions. The management of elderly trauma patients requires knowledge of aging physiology, a focused triage based on assessing frailty and early activation of trauma protocol to improve outcomes. Geriatric intensive care units are needed to care for elderly and frail trauma patients in a multidisciplinary approach to decrease mortality and improve outcomes. PMID 388167660I 10.1186/S13017-024-00537-8. Document the CPD share evidence. Estimated reading time, 6 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. The 2023 WCS Guidelines on the Management of Trauma in Elderly and Frail Patients. Title: VR-related evidence matrix. Evaluation of management of CT scan proved solid organ injury in blunt injury abdomen A prospective study. Frailty and in-hospital outcomes for management of cardiogenic shock without acute myocardial infarction. Curious. 2024 April 29, 16, 4E59263. DOI 10.7759/curious.59263. eCollection 2024 April. Abstract. Introduction delirium is a common and serious neuropsychiatric disorder of acute onset, present at any age, but more common in older adults and very common in clinical practice. It combines mental and behavioral symptoms with a fluctuating course, with worsening of the condition in the afternoon and at night, with important repercussions on increased mortality, greater risk of cognitive impairment, and hospitalization costs. Delirium's impact extends to patients, families, and healthcare systems, emphasizing the need for public awareness and education in Saudi Arabia. Methodology: it is a cross-sectional conducted in Saudi Arabia that aims to assess knowledge, risk factors, and attitudes regarding delirium among all Saudi and non-Saudi residents aged 18 and older. A 36 self-administered questionnaire, standardized Nordic, was used. Data were cleaned in Microsoft Excel, Microsoft Corporation, USA, and analyzed using IBM SPSS Statistics, IBM Corporation, Armonk, New York. This study was conducted in Saudi Arabia from May 2023 till March 2024. Results: our study involved 1,470 participants from Saudi Arabia, primarily females, 79.1%, Saudi nationals, 89.9%, and unmarried individuals, 65.4%. Most participants were aged 18 to 24, 59.5%, and held bachelor's degrees, 57.3%. Commonly recognized delirium risk factors included increasing age, 63.3%, dementia, 58.2%, and longer ICU stays, 48.7%. The participants showed moderate knowledge of delirium symptoms and consequences. Attitudes varied, with many agreeing that delirium requires intervention, 30.7%, but fewer considering it preventable, 17.1%. Socio-demographic factors, including gender and age, significantly influenced knowledge and attitudes, while education levels did not. Conclusion: our study found that gender and age influence knowledge and attitudes, highlighting the importance of targeted education. Future research should further investigate the effectiveness of such interventions in enhancing knowledge and awareness and promoting preventive actions. PMID 388132888 PMC PMC 11134522 DOI 10.7759/curious.59263. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Delirium knowledge, risk factors, and attitude among the general public in Saudi Arabia, a cross-sectional study. Title: VR-related evidence matrix. Factors affecting breast cancer screening behavior among BRJ Neuroscience. 2022 October 1, 18, Sub 5 S18, S21. DOI 10.12968/BJNen.2022.18 Sub 5.S18. EPUB 2022 November 1st. Abstract. Delirium is a common presentation after acute stroke. Post-stroke delirium is related to poor recovery, higher rates of mortality, falls, and longer hospital stays. Delirium can lead to challenging behavior such as anger, aggression, and confusion. As such, it is important to identify delirium promptly for early management and to reduce the negative impact on post-stroke recovery and outcomes. An important aspect of identifying delirium depends on the use of efficient, easy-to-use, and validated assessment tools. A wide range of tools are available, although it is not known how accurately they can identify post-stroke delirium. This article critically appraises a systematic review which identified delirium screening tools for patients with acute stroke and summarized their accuracy. PMID 388129778 PMC PMC 76166030 DOI 10.12968/BJNN.2022.18 Sup 5 S18. Document the CPD share evidence. Estimated reading time 3 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Diagnostic test accuracy of assessment tools for detecting delirium in patients with acute stroke. Commentary of a systematic review. Title: VR-related evidence matrix. Prevalence of post-stroke delirium in acute settings, a systematic review and meta-analysis. Prevalence of clinical electroencephalography findings in stroke patients with delirium. Transplant-associated altered mentation and encephalopathy, TAME, a new classification for acute neurocognitive changes associated with hematopoietic cell transplantation from the ASCT Committee on Practice Guidelines. News 2 shows low sensitivity and high specificity for delirium detection, a single-site observational study of 13,908 patients. The impact of delirium on clinical and functional outcomes in hospitalized patients with acute coronary syndrome. The impact of delirium on clinical and functional outcomes in hospitalized patients with acute coronary syndrome. Nursing experiences and knowledge of pediatric delirium, analyzing knowledge practice gaps. The impact of delirium after radical prostatectomy on cognitive function and health perception during the recovery period. Incidence and assessment of delirium following open cardiac surgery, a systematic review and meta-analysis. Delirium in a surgical context from a nursing perspective, a hybrid concept analysis. The predictive value of confusion assessment method, intensive care unit and intensive care delirium screening checklist for delirium. BMC Women's Health. 2024 May 29, 24, 1311. DOI 10.1186/S12905-024-03153-5. Abstract. Introduction. Perioperative urinary tract infections, PUTIs, are common in the United States and are a significant contributor to high healthcare costs. There is a lack of large studies on the risk factors for PUTIs after total hysterectomy. Methods. We conducted a retrospective study using a national inpatient sample, NIS, of 445,380 patients from 2010 to 2019 to analyze the risk factors and annual incidence of PUTIs associated with TH perioperatively. Results. PUDs were found in 9087 patients overall, showing a 2% incidence. There were substantial differences in the incidence of PUDs based on age group, p less than 0.001. Between the two groups, there was consistently a significant difference in the type of insurance, hospital location, hospital bed size, and hospital type, p less than 0.001. Patients with PUDs exhibited a significantly higher number of comorbidities, p less than 0.001. Unsurprisingly, patients with PUDs had a longer median length of stay, 5 days versus 2 days, p less than 0.001, and a higher in-hospital death rate, from 0.1 to 1.1%, p less than 0.001. Thus, the overall hospitalization expenditures increased by $27,500 in the median, $60,426 versus $32,926, p less than 0.001, as PUDs increased medical costs. Elective hospitalizations are less common in patients with PUDs, 66.8% versus 87.6%, p less than 0.001. According to multivariate logistic regression study, the following were risk variables for PUDs following TH: over 45 years old, number of comorbidities, greater than or equal to 1, bed size of hospital, medium, large, teaching hospital, region of hospital, south, west, preoperative comorbidities, alcohol abuse, deficiency anemia, chronic blood loss anemia, congestive heart failure, diabetes, drug abuse, hypertension, hypothyroidism, lymphoma, fluid and electrolyte disorders, metastatic cancer, other neurological disorders, paralysis, peripheral vascular disorders, psychoses, pulmonary circulation disorders, renal failure, solid tumor without metastasis, valvular disease, weight loss, and complications, sepsis, acute myocardial infarction, deep vein thrombosis, gastrointestinal hemorrhage, pneumonia, stroke, wound infection, wound rupture, hemorrhage, pulmonary embolism, blood transfusion, postoperative delirium. Conclusions. The findings suggest that identifying these risk factors can lead to improved preventive strategies and management of PUDs in TH patients. Counseling should be done prior to surgery to reduce the incidence of PUDs. The manuscript adds to current knowledge. In medical practice, the identification of risk factors can lead to improved patient prevention and treatment strategies. We conducted a retrospective study using a national inpatient sample, NIS, of 445,300J. Pain Symptom Manage. 2024 May 27, S0885-3924, 24, 00793-0. doi, 10.1016/Jade, painsemen.2024.05.024. Online ahead of print. Abstract. Context: delirium is a significant concern in end-of-life care. Continuous monitoring of agitation levels using objective methods may have advantages over existing measurement scales. Objectives: to examine whether an objective measure of activity scores measured using a sheet-type non-wearable sensor, Nemuri scan, NSCN, was correlated with agitation levels measured using the Modified Richmond Agitation Sedation Scale, RSS, in terminally ill patients with cancer. Methods: we conducted a single-center, prospective, observational study in a palliative care unit using the NSCN to measure activity scores and the RSS to assess agitation levels. RSS scores were prospectively measured by ward nurses blinded to the NSCN variables. A database was created to pair the RSS scores and activity scores at night on the same day. Results: during the observation period, 1,209 patients were hospitalized, and 3,028 pairs of assessments of 971 patients were analyzed. The NSCN activity scores significantly increased with increasing RSS scores, Jankier-Terpstra test, p less than 0.001. The mean values of the activity scores for each RSS score were RSS-5, 28.9, RSS-4, 36.4, RSS-3, 41.7, RSS-2, 57.4, RSS-1, 58.8, RSS-0, 62.6, RSS-1, 79.6, RSS-2, 106.5, and RSS-3, 118.7. Conclusion: the NSCN activity significantly correlated with modified RSS agitation scores. Real-time NSCN data on agitation may aid timely interventions for optimal symptom control. To improve outcomes for patients suffering from terminal delirium, more research on monitoring tools is warranted. PMID 388109949 10.1016/J Painseaman.2024.05.024. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. A novel objective measure for terminal delirium, activity scores measured by a sheet-type sensor. Title: VR-related evidence matrix. Impact of prolonged continuous ketamine infusions in critically ill children, a prospective cohort study. Systemic inflammation and delirium during critical illness. The effect of deep and awake